5 minutes after 11 o'clock. Thank you for tuning in. Have you ever seen one of those charts that shows you how much money it costs to raise a child?
Oh, yeah.
You say, oh my gosh, I remember I raised my son. I don't remember thinking about the numbers like that, but I'm sure they're true. I mean, it's everything from the daily diet to college in the future to healthcare.
Oh, sure.
And healthcare is what we want to focus on right now. Yes, you have to think about that, and obviously you want your children to be healthy, and doctors are not free. Verlon Johnson is on the phone to talk to us about this. Verlon is the Associate Consortium Administrator and Director of the Special Initiatives Division in the Consortium of Medicaid and Children's Health Operations, speaking to us about outreach and enrollment efforts to help eligible children in Florida obtain health coverage year-round through Medicaid and the Children's Health Insurance Program. My goodness, how many people are going to be saying thank you for this program? Verlon, good morning. How are you?
Good morning. I'm great. And how are you all doing today?
I'm pretty good. Where are you?
I am actually in the Chicago area.
In Chicago. Well, thank you for being on the air with us. How's the weather there today?
It is beautiful, but it's going to be hot like Florida, and I'm not sure I'm ready for it.
It was really nice here, too. So how are we doing as a nation as far as getting health care for our children? And I guess mostly I want to ask about the people who are having a hard time with money.
Yeah, so, we are actually doing a lot better than we were about 8 years ago. With the Affordable Care Act, we've seen a lot more people get access to the health care coverage that they need. Currently, though, now we still have about 8.8 million children who are eligible for Medicaid and CHIP, and they don't know it. And so that's why I'm really glad I'm able to talk with you all today. Specifically, in Florida, I think we have about 300,000 children who are still looking for this coverage as well. So, we really want to make sure that we're giving them information that they need to get this health care coverage today, if possible.
Okay, so when you said CHIP, that stands for Children's Health Insurance Program.
Exactly, and I'm sorry, we are the government. We, of course, have lots of acronyms.
Right. I wanted to ask this, though. When a child goes to school, they have to have certain vaccinations. If it turns out that they don't, does the school ask the parents questions so they can figure out if the child might be eligible for CHIP?
In most cases, they do, and I think Florida does a good job of that as well. They'll basically ask them what the barriers are to not getting the forms they need filled out, and then they may point them to the health insurance program with this CHIP or the Medicaid program to see if they qualify. If the barrier may be money instead of something else.
Okay.
And this is more than just health. I mean, this includes dental and eye exams, prescriptions, and also mental health services.
That's exactly right. It is a robust number of services available to our kids under the Medicaid and CHIP program. Kids definitely need immunizations to participate in activities at school, to get into school. They need those regular checkups. And, if kids want to play sports, the first thing the coaches are going to ask for is that sports physical. And the last thing we want a parent to say is that, no, we didn't have enough money to go and get that physical, and so we want to make sure kids can get that through the CHIP program as well. So those are some key services that we can definitely provide under the Medicaid and CHIP program.
Are there, rules for the parents? In other words, what am I trying to ask you? Like dollar amount, like do their earnings, are their earnings considered, is that part of this?
There is. So Medicaid and Children's Health Insurance Program, or CHIP, it actually provides health insurance for children and families with low and moderate incomes. And so what we mean by low and moderate incomes is that families who make about $48,600 a year may qualify for those programs. And it's really easy for them to figure out if they're eligible. All they have to do is go to healthcare.gov, and that provides them with what they need to learn about the CHIP program, the Medicaid program, or they can call 1-800-318-2596. And again, that too will tell them all they want to know about the programs and if they qualify or not.
If the parents have opted not to enroll in the health care program, let's say, I don't know, there's the political reasons or maybe pride reasons, does that leave the child out, or can a child still get the program even if the parents have decided they didn't want to participate? And if you're a parent, why are you doing that?
Yeah.
I mean, it's there. It's an opportunity. But that's okay. I got off my soapbox. But I mean, is the child? Yeah, is the child still able to get health care?
Absolutely. The CHIP program is just for that, Children's Health Insurance Program. Kids can get access to that care. But like you said, most kids who are on CHIP, or a lot of kids who are on CHIP, their parents may qualify for Medicaid as well. And so, it's great to have our kids healthy, but it's, because we want to make sure they go to school. They participate in all the activities available to them. They're able to, with their eye exams, look at the bulletin boards. They're able to participate in the sports and all those great things and not miss a day of school. But we also want to have healthy parents, because we have healthy parents, they can make sure they're keeping their kids healthy too as well. Right? So that's important.
And that's really wonderful that a parent can earn up to $40,600 annually, because that includes teachers, that includes law enforcement officers, firefighters, families, because way back when we only thought that if parents earn like $19,000 a year, that was the cutoff.
Right, exactly. So definitely, if a family is a family of four and they earn up to that, then they can definitely probably qualify for the program as well. And the other thing that I want to stress is that they can apply any time. Back to school is a great trigger to remind ourselves the need for our kids to be healthy, and that's a great time to make sure we have our coverage that we need. But your circumstances may change. People lose their jobs. They may change jobs for whatever reason they need to change jobs. Their incomes may go down, and so they may lose their health coverage that they have right now. And so at any given time, they could actually apply, whether it's this month in September or November or even February. So I really want to stress the importance that it can happen at any given time.
Absolutely. I mean, it's a really good program, and thank you for helping us get the word out about it. Or, you know what I wanted to ask you, though? Let's see. I saw that it goes up to 19. I was surprised to see that a 19-year-old is still considered a child, which is awesome.
Right.
So what do they do? What does a parent do? Do they? Is it the number you just gave?
Yeah. So they could, they can call 1-800-318-2596, and there are operators on the line to help walk them through their circumstances and how they will qualify for the program. But a lot of people are on the go. They have their mobile apps and their phones, so they can also go to healthcare.gov and do it there as well. And that's a great way for them to actually see it face-to-face in terms of comparing what may work best for them.
1-800-318-2596. Did I write it down correctly?
That is correct.
Okay.
Exactly.
All right. And I'll make sure that I hold on to it. If you're listening and you need that repeated, maybe you're driving or whatever, I wrote it down, so I've got it. If you want to just call us, I'm sure Robin or I or somebody here will be able to tell it to you. Okay, so the good information is that it's there. Does it vary from state to state, or is it across the board, the whole country?
Well, in terms of the programs, that's pretty much stable across the country. There may be a little bit more enhancements in some states, but for the most part, what I told you in terms of immunizations, checkups, and all of that is across the country. So if you have people driving to the area that aren't there, they're visiting from somewhere else, they can still call that number and figure out what works best for them in their state.
And if they're, let's say, if they're here but they don't live here, and if you don't mind me bringing in immigrants as well, are they eligible for this or no?
Well, so part of it, of course, is that you do have to be a citizen, so that would be very important as well. But there are probably other options, too, out there for immigrants and others who may need additional help. But if they're here on legal status, they can definitely apply for the program, too.
Oh, nice.
All right. And obviously this is across the country. So, and I noticed part of my notes indicate Georgia, so I guess, you must be representing the Southeast, it looks like. Well, you don't think of Medicaid for children, but here it is. This is the program called CHIP. Yep. Children's Health Insurance Program. Well, thank you, Verlon, for being on the air with us this morning, and come back anytime. Thank you for giving us this great information.
Thank you so much. Have a great day.
Thank you. All right, we will take a little break, and we'll be right back.